Hi, everybody. Good morning. Thank you for being here for our monthly Mayor's Press Conference. Today, we're going to be offering a lot of updates on community safety topics, so it's great. Just a reminder that the mayor and other speakers will take questions at the podium related to the community safety topics that we cover today. Any other questions outside of those, come find me after, and I'll set up a brief one-on-one interview with the mayor or with another speaker. I'm Jen Monroe Zakaris. I'm the Deputy Chief of Staff for the mayor. All right.
Great.
Thanks.
Thanks, Jen. Okay. All right, good morning, everyone. And nice to see people again. If you came here yesterday, it feels like this is the week of press conferences for our office. Good morning, and thank you for being here this morning. As Jen just mentioned, this is my monthly press conference, and today's focus will be on community safety. We spent much of last year doing every month an update on community safety, and we felt it was timely to bring back community safety versus other general city affairs that we often now cover in these particular press conferences. But before we move to the data and the program updates, I want to take a moment to acknowledge people. This is an important part of being mayor, to acknowledge the leadership and hard work that city staff and our community partners do every day. I want to first thank our Chief of Police, Shawn Burke, from our police department. Chief Burke has led with a steady focus on data, deployment strategies, and community engagement. And you will see the results of this hard work, his hard work, and his team's hard work in today's update and data trends. I also want to recognize our Fire Chief, Michael Curtin, and the entire Burlington Fire Department. Chief Curtin's leadership has ensured that our firefighters are not only responding at record levels, but doing so with professionalism and compassion. A special thank you to Anna Wageling. Wageling? Yep. Oh, thank God. Phew. Okay. It's like the names are my secret, like kryptonite. Anyway, a special thank you to Anna Wageling and the team behind Burlington Police Department's CAIP program. The work sits at the intersection of enforcement and service connection, and Anna and her team are essential bridges between our systems and our community members. I also want to recognize Rachel Jolly and Becky Penberthy for their leadership in the Burlington's Community Justice Center. The expansion of restorative justice through initiatives like City Circle and pre-charge diversion requires careful coordination, victim outreach, volunteer training, and rigorous follow-through. Rachel and Becky and their team are helping to ensure that restorative practices in Burlington are not symbolic. They are structured, accountable, and measurable. Thank you also to State's Attorney Sarah George, who was unable to attend here today, but her partnership and her broader colleagues in the legal community are very important to our accountability system. It's ever evolving, and it's whether it's diversion, restorative justice, or structured court oversight, none of these tools function without collaboration across the legal system. And finally, I'd be remiss if I didn't acknowledge Jeff Nicholson, or as many of us know us in the city, Data Jeff. Jeff helps turns our numbers into insights. And Jeff ensures that they are always grounded, we're grounding our decisions in real analysis. That work matters. Good data leads to better policy, better deployment, and ultimately better outcomes for our community. There he is. You were hiding behind a person. All right. Community safety is truly a team effort. It spans departments and agencies, nonprofits and courts, volunteers and analysts. I'm grateful for their professionalism, their partnership, and persistence each of these leaders brings to the table. One of the commitments I made as mayor was that we would talk about community safety in a way that is transparent, data-driven, and grounded in solutions. And today is about showing the community where we are, what the data is telling us, and how the different pieces of our community safety toolbox and strategies are working together. You'll hear shortly from the Burlington Police Department about the year-end data for 2025. That data spans more than a decade and helps us understand long trends in incidences, patrol activity, and violent crime in the Queen City. What's important is that we are not relying on anecdotes. We are looking carefully at patterns, identifying where we're making progress and where we still have work to do. You'll also hear from the Burlington Fire Department, which responded to more than 11,500 incidences in 2025. This was the busiest year in its history. The majority of those calls were EMS related. That tells us something very important. A significant share of what we call community safety is actually about medical response, behavioral health crises, and people in acute need. Our firefighters and paramedics are often the first point of contact for someone experiencing an overdose, a mental health crisis, or a traumatic injury. Their work is critical to saving lives and stabilizing situations before they escalate. But enforcement and emergency response alone are not enough, and that is why we are investing in upstream and collaborative interventions like the Situation Table. Over its first 6 months, the Situation Table has brought together more than 24 agencies to intervene in early in 50 situations of acutely elevated risk. This is about breaking down silos, ensuring that when someone is at risk of harming themselves or others or cycling repeatedly through a crisis, we intervene collectively and quickly. We are also beginning to gather data about systemic barriers, gaps like sober housing or transportation to services, so we can advocate more effectively for more resources. That's how we're going to be able to move from a case-by-case response to structural solutions. Another key piece of our toolbox is, of course, accountability, an accountability that repairs harm and prevents repeat low-level offenses. Through the Burlington Community Justice Center's new City Circle pre-charge diversion pilot, we are offering a restorative justice alternative for low-level offenses, ordinance violations. Instead of defaulting to court, individuals can participate in a facilitated circle that centers accountability, repair, and connection. City Circle is voluntary. If someone completes the process and the agreement they help craft, the ticket is then voided. If they decline or fail to participate, the case returns to the traditional legal process. Early data shows referrals are moving through the system and participants are engaging. And our volunteers, which are all Burlington residents, are stepping forward to help hold their neighbors accountable in constructive ways. That is accountability without shame, repair over punishment, and early intervention to prevent cycles of repeat behavior. And finally, you'll hear updates on our Community Accountability Court, delivered by me on behalf of Sarah George, which was established by the governor 3 months ago. That countywide court is focused on structured oversight and case progression for individuals with complex and repeated involvement in the system. We now have early data on the docket's progression, active and resolved cases, and outcomes. It represents yet another tool, one that combines judicial supervision with coordinated services. And when you look at all of this together, police data, fire response, the Situation Table, City Circle, and Accountability Court, what you will see is a layered and strategic approach. We are strengthening traditional enforcement where necessary. We're investing in emergency response capacity. We are coordinating earlier around higher risk situations in our community. We are building restorative pathways for low-level violations. And we are supporting structured accountability for repeat complex cases. No single strategy will solve every challenge in our city, but taken together, this is what holistic community safety framework looks like. It is data informed, it is collaborative, it is balanced, and it is focused on both immediate safety and long-term stability. Our job is to keep refining these tools, measuring what works, and being honest about what we need to adjust. And that is what today's update is all about: progress, transparency, and continued commitment to a safer Burlington for everyone. And with that, I'm going to turn it over to our presenters. Up first, we will hear from our Chief of Police, Chief Shawn Burke.
Thank you, Mayor. All right, good morning, everybody. We've got some high-level metrics from the Burlington Police. This first illustration is total number of incidents the Burlington Police Department has responded to or attended to from 2012 to 2025. Why that date range? 2012 is when our contemporary records management system came online initially. You can see that we had a high of about 37,000 incidents in 2015. That's when the police department was staffed with upwards of 95 officers, and we were doing much more proactive work with the discretionary time that the team had. Like every other police department, you'll see a drastic drop as we progress through the pandemic, and now we're on the upside of that. And in 2025, having responded to just shy of 35,000 incidents, this is really emblematic of all aspects of our police department. So when you think about the police department, you see black and white cars in blue uniforms like I'm privileged to wear here this morning, but really behind that we have our emergency call takers in the dispatch center. Between police and fire, they dispatch 47,000 incidents per year. And then we have our team that you'll hear more about from Anna in the CAIP, as well as our community service officers. These metrics represent all of that collective work. Next slide, please. Our top incidents in 2025, which we are very proud of. You'll see the top one is foot patrol. So we really doubled down, particularly in the downtown district last spring when I came on board. It wasn't lost on me that the city had kind of grappled with a few different hotspots within the downtown sector over the previous few years, one being Buell Street, the other being in the parking garage. City Hall Park in the marketplace was likely going to be the next area that was affected. So we wanted to get out early and to really set the tone that the police were present. And we know that any time that you want to stand up an effective deterrent model, a person that is going to engage in illegal or any type of disorder, there has to be some type of likelihood that you're going to be caught doing that behavior, and then some type of swift consequence. The next metric that we saw a drastic increase in is directed patrol. The difference between foot patrol and directed patrol, foot is just that, staff out on foot. Directed patrol are motorized patrols of hotspot areas. Suspicious events is typically a data point that is quite elevated in every police department. What this really means to me as a public safety professional is someone feels unsafe about the situation they're observing. So this can be a messy bucket where someone heard a bump in the night that might be a window shutter that has blown loose, or it could be something that's perceived as a drug deal or something otherwise not confirmed as a category, as a crime that we categorize. The next one I'd like to talk about briefly is trespass. So given the number of unhoused individuals in our community, this is not a shocking number to any of us that are on the front lines doing this work, but it is a troubling trend because this is an area that we literally cannot enforce our way out of. There are simply not enough places for people to sleep or otherwise shelter, and it really takes hold of the downtown, particularly overnight, when you think about where people may try to stay either on a loading dock somewhere or on a closed commercial property. In addition to all the incidents of trespass that we deal with during the day when businesses are open and trying to really drive the economic vitality of downtown. The rest of the categories here are rather self-explanatory. What I do like to highlight on this particular slide, though, captured here in our top 20 incidents are mental health calls, overdose calls, welfare checks. These are all areas where we're beginning to use street outreach professionals as well as our community support liaisons as primary responders if danger acuity allows. So this is actually testing the experiment of what professional staff can do in lieu of police officers. We're a few months into this. The direction went out to staff last September. I feel after 6 or 8 months, we should have sufficient data to really analyze what we've been doing, its efficacy, and how we could potentially advance that work more broadly. Next slide, please. This is just a line graph showing our patrols. So again, this is a combination of foot patrol and directed patrols, and you'll see our efforts in 2025 far eclipsed earlier years. One highlight here is directed patrol is a rather new category. We weren't necessarily capturing our efforts toward motorized patrols in these earlier years, but Jeff has really helped me understand a lot of these metrics, and we know that this top red line number is driven in large part by our foot patrols in the downtown area. Why the high point in July? There was a lot of activity in City Hall Park in downtown. Tapered off through August. We have not only low census to begin with, but we've also been in a time in the organization where we have a number of officers that are unavailable due to injury, or they're off the job pending legal review by the Attorney General's office. So we simply had fewer people doing this work. And I will say that post-resolution in September, a majority of this work was focused really targeted on the downtown district. I think that's my last slide. One more. Violent crime, the most important one. I thought it was 3, 4, 7. So this is actually the one that I am most proud of. When you look at our violent crime levels here in 2025, a dramatic drop in my mind of what's going on here. The top red bar is the section that is labeled homicide. By virtue of our records management system, this is not only homicide, but attempted homicides. So in 2025, we had 2 incidents. We had the shooting incident on Isham Street in early spring, and then we had the homicide on Church Street here in August. The next category, which is that goldenrod color, is labeled robberies, but in Vermont, by way of statute, robberies are categorized in two ways. Assault robbery, which is the classic present or threat of a weapon, usually at a convenience store or the like, where the suspect is unknown to the parties. But then there's this other category of crime called larceny from a person. And this is any time that something is stolen directly from a person. Parsing through these incidents over the last year, a majority of these incidents occurred in the downtown. They're larceny from persons. They're people involved in the drug trade, and they're either stealing cash, drugs, cell phones, or anything that can be easily tendered from one another on a fairly frequent basis. That is troubling. This is, a tough area for the criminal legal system to kind of parse apart when thinking about how to deal with these folks because of the underlying issues. But what I want to be emphatically clear about is that these are not sidewalk stick-up robberies or a trend that we're concerned about in the downtown, but rather folks known to one another engaged in this activity that we don't really have a solid solution for as of yet. Then the other two categories here are both assault categories, one being simple assault, the other being aggravated assault. Aggravated assault is a felony. What typically predicates an assault being aggravated is the introduction of a weapon or degree of injury. A simple assault is everything else. So again, fairly static numbers across assault and aggravated assault, a little bit of a downward trend. Really proud of the work that's been done in terms of the serious violent crime. Reckless endangerment is at the top there, the orange bar. Those incidents are, again, seemingly like, what is that to the public? Those are oftentimes gunfire incidents where no one is struck and we don't have cooperating victims. So reduction across that category. And just to kind of call this out from 2025, from earlier years where there was really an epidemic of gun violence in the downtown, there was some key prosecutions that were carried out by the U.S. Attorney's Office in a lot of those cases, and that helps shape deterrence. The other thing that's super important about this work is having cops out in the space. We know we deter violent crime. So again, this is really not about a strategy that was set forth by police administration, but an idea that we knew that worked, and our team really adhered to that idea and deployed in meaningful ways in 2025, and we're thankful for their work. Thanks.
Glad you didn't miss that one. That was
my moment.
That was the moment, yes. So thank you, Chief. I appreciate it. And next up, we'll hear from our other chief, our chief of the fire department, Chief Curtin.
All right, thank you, Mayor. Good morning. So as the mayor said, 2025 was our busiest year on record in the department's 130 years of existence. We answered 11,533 calls for service. Sort of a breakdown is fire incidents were 1,782, EMS was 7,689, and the rest was everything else you can think of, like technical rescue incidents, stalled elevators, those type of incidents. You can see here, this is sort of the categories we break down those incidents and how EMS is the predominantly busier discipline. The graph all the way to the right shows the call volume throughout from 2021 to 2025. And every start of the year, you can see that we start higher than the last year previous. And this January was no different. Some of the fire incidents, we had 22 building fires in the city this past year and 8 mutual aid incidents. Perfect. So this kind of gives you an idea of where most of the majority of our incidents are happening throughout the city and a breakdown of each company. You can see an increase in every company with the exception of the tower and I think ladder 4, and they had a very minimal decrease, like 0.7 or 0.9%. But this gives you an idea of what each company is doing for run volume. As I said before, EMS is the majority of our incidents. That's anything from cardiac arrest, seizures, traumatic injuries, car accidents, those type of emergencies. Overdoses, you can see December we only responded to 15 that we transported. And the diagram below shows we were dispatched for a medical overdose, but only about 20 to 40% of those are actual confirmed overdoses. And that could be because the person's already left the scene, wants nothing to do with EMS, or the person sleeping, it wasn't an actual overdose call. And when we are not answering all those calls, we're training. So in 2025, members did over 16,000 hours of training. As a matter of fact, if you go over to Central right now, they're in the basement drilling on search and rescue techniques. So that's sort of what we do when we're not answering all those calls for service. We're preparing for that next call or whatever challenges we may face. Thank you.
Seen. Okay, great.
Yeah.
Thank you, Chief. Appreciate it. So take that one. Okay, great. Thank you. And next up, we'll hear from Anna Wageling, who is leading our situation table. This is the new initiative we started about 6 months ago in July.
Good morning, everyone. All right, so we're going to go over some overall numbers. So we've had 50 situations so far after the situation table started in July of last year. We had 40 from July through December, and then we've had 10 so far. We've had 15 different agencies who have presented situations, which is quite impressive. And then 28 total agencies have helped as members of the Filter 4 team. So the Filter 4 team is really that group of providers who come together to collaborate on supporting someone, getting them connected to services, trying to decrease the number of calls to BFD, BPD, et cetera. So the Filter 4 team is the term that we use. All right, next slide. Originating agencies. So these are the agencies who bring forth someone identified as potentially needing support. As you can see, Burlington Police Department is the top, closely followed by the hospital. Thank you to Beth Riley for bringing all of these situations. This I find quite impressive. Many other situation tables across the state and nationwide, it's almost solely the police department that is bringing up situations. So I'm seeing this as really a community effort to look at folks who are struggling in our community and how can we try to get them engaged, as opposed to just who are the folks who are interacting the most with the Burlington Police Department. All right, next slide. And then these are the assisting agencies. So as you can see, there's a very long list. This highlights the agencies who are at the table. All agencies who attend have raised their hand to join the Filter 4 team. Again, this also highlights the need in our community. If you go to the next slide. So these are the top risk factor categories. So when we talk about risk factors, that means that basically we go through a list and we say this particular person or this family we think is really struggling with these different categories, or that person or family has identified they are struggling with this topic. As you can see, the top three, unsurprisingly, mental health, housing, and basic needs it's a struggle for those to be met for our community members. All right, and wow, I did that so fast. So what's next? So basically, when we were closing situations, we found that there were more systemic barriers. So we were saying, okay, the risk has been lowered, but it's not enough. We need more, and so what we decided to do as a Burlington situation table is we created an additional way of collecting more specific reasons folks are struggling. So some examples the mayor had mentioned earlier: no appropriate shelters. We don't have enough shelter space that is appropriate for the folks and what their needs are. Lack of transportation, as we know, living in Vermont, that's a big thing. Or maybe that person was trespassed from the bus, so now they really can't get anywhere to attend to their needs. And no rehabilitation. We know that we do have rehabilitation in the state, but it's not enough for the folks who need it and for the length of time that is needed. So basically, we created the systemic barriers separate sheet to highlight these different things, and we are hoping that this will lead to better advocacy, and again, to really highlight it's not just mental health. We can really dig in to see what exactly is going on in our community. Thank you.
All right. And then lastly, before I speak about the accountability court, we'll hear from Becky Penberthy, who's here to speak about City Circle, which is our newest piece of our community safety strategy toolkit. Toolbox? Tool in the something. Tool. Yeah, tool.
Thank you, Mayor. So I have only one slide for you, but I want to orient you all to the Burlington Community Justice Center just a little bit. In many ways, City Circle is the work done at the Burlington Community Justice Center each day. We're a team of 19 people. We're in 3 locations: Lower Church Street, we're in the Costello Courthouse, and we have Parallel Justice, a victim service specialist at the Burlington Police Department. In our work, a person commits a crime, breaks rules, starts a conflict, and people are really angry and they're hurt and scared and they're tired of this because they've experienced this harm and they know others who have too. We work to address that harm. We work with people to take full responsibility for their actions and support them to attend to those underlying conditions that might be causing those actions. Sort of what you were talking about. We offer support to those who've been harmed, and in the ways that they identify they'd like that support. And City Circle seeks to do all of these things, but in a much more rapid way. So an officer might issue a ticket on a Friday, and we might meet that person on a Monday, and we might have already contacted the victim in the perfect world. 6 trained volunteers. So when the mayor and others put out a call for City Circle volunteers, our volunteer base increased rapidly, which told us people really wanted to do this community work. And we couldn't place them all in City Circle, but we found other opportunities for them to volunteer with us. So we have 6 trained, committed folks who live or work downtown. We hired a staff that's, they're a pre-charge diversion restorative justice coordinator, but they are specifically assigned to City Circle, and that's what they've been focusing on. So 10 tickets issued, 4 for open containers. There was an unregistered and unvaccinated pup, which resulted in 2 tickets. 2 folks were ticketed for unlawful trespass, 1 for camping and 1 for littering. So we've only met 2 of these folks. We got 5 tickets initially for 4 folks, and 2 came in and met with us and have participated in a circle, and they're in the process of repairing the harm that they caused. 1 learned about the circle process and declined. So that person's ticket was sent off to the city attorney's office for review and potential adjudication. Let's see, what else? We just got 4 new tickets yesterday. So we haven't met these folks, but maybe we'll meet them on Monday. The Burlington Community Justice Center, last fiscal year, I gotta jump in on the fiscal year data, served 2,100 folks. Thank you very much.
And if this wasn't clear, the city, well, both actually meet on a weekly basis, Situation Table and City Circle. So it is a system that, as it gets up and running, it began in January, will continue to be more widely understood and widely utilized, I hope, within the city. All right, now I'm going to do my best attempt to stand in for our state's attorney, Sarah George, on the Community Accountability Court. So our Chittenden County State's Attorney, Sarah George, could not be here today, so I'll give a high-level overview of the court. This was a special docket created by Governor Phil Scott with our recommendation aimed at clearing a significant backlog of mostly low-level cases and it was overseen by Special Prosecutor Zach Waite. According to the data, about 78% of the cases at the start of the docket have been resolved, making a significant dent in the backlog that has plagued our county for many years. On this first slide, you can see here that in total, the Accountability Court resolved 79 defendants' cases and closed 702 dockets. This whole court system or special docket was really built upon really targeting folks who have multiple open dockets. And so it wasn't just for folks with individual situations within the court system. And this shows, again, a significant 78% clearance rate is significant in the size of numbers of dockets that were sort of, again, backlogging our local court system. This means that individuals, in terms of what happened, were either incarcerated, placed on probation, ruled incompetent to stand trial, released on an order of non-hospitalization, assigned to treatment court, assigned to ACS, deceased, and or had their case actually dismissed at the end. The next slide shows that the substantial increase in the resolved dockets and decrease in the active dockets over the time that this court has been operating, which is back to about October or so. The next slide shows that the number of resolved defendants, and so their cases. So you can see overall what's been active, what warrants were issued, et cetera, in those several hundred cases I mentioned. The next slide shows what I was mentioning before about what happened. So what are the outcomes that came of these dockets being resolved? And as you can see here, this includes things like prison, probation, or probation with treatment court, and or cases that were actually ultimately dismissed. And while the Accountability Court is now Per the governor's decision, now closed officially, State's Attorney Sarah George has worked diligently with the court to find a way to keep some aspects of the program going. Moving forward, her office will be keeping folks with high risk and high needs on a faster track to trial, and will work with the Vermont Agency of Human Services to connect those folks to services. I'm very appreciative of State's Attorney Sarah George's work and commitment of pulling through the things that we learned from this accountability court, and it is very important that we continue to resource, of course, the county system to make sure that we don't find ourselves in another couple of years in the same place that we landed with such a backlog, because our court system was so under-resourced and overloaded with work. And when we look at proportionally in the state, as a mayor here in Chittenden County holds so much of what's going on in the state. And so we really need the resources to be proportionally distributed so that our law enforcement and our accountability system can actually function. So as we close today, I want to underscore something important. Community safety is not a static goal. It's ongoing work. It requires us to examine data, to adjust when something isn't working, and to stay committed to collaboration even when the challenges are very complex. What you've seen here today is a city that is using every tool available to make Burlington safer in both the short and long term. We're making significant progress, and I hope that's the takeaway here, is that we are truly making significant progress. And Burlington is being more responsive than ever before to our complex community safety challenges. I also want residents to know that this is your work too. As we mentioned in some of the presentation, volunteers are participating. They're helping us in this community safety response. Through things like a city circle, and agencies as well, who are part of our community, of course, are helping us within the situation table. Officers are doing foot patrols, firefighters are responding to crises, court partners are moving cases forward. All of this is in service of a safer and more stable community. We will keep reporting on our progress as a city, and keep building a system that is fair, transparent, and effective. I want to thank you and thank everyone who's been part of this effort. And now we will open it up for questions.
I know obviously things take time and good things take time, but would you say over the past year, people's quality of life have truly improved after this presentation?
So I think there's a number of reasons why what goes into quality of life. It's not just community safety, of course. It's also about the vitality of a community. It's about the strength of the community and connectiveness. But we have been hard at work since day one. Community safety has been the top priority of this administration. And I can see, I'm sure you can see the results, especially in 2025, as we started to fully implement different strategies and bring back strategies that we know work, especially within our police department. We have seen a downtick of concerning trends and an uptick of new ways we can engage folks to bring their risk levels down in our community. I think there's a long-going issue with Burlington and the perception of our city. And what we want to make sure we're doing is giving folks a fair and data-based information about what truly is happening in our city and where we're headed. We're making significant progress, and I hear anecdotally and factually now with data that gives me great confidence that we are building momentum in the right direction and building a healthier and safer community. Mm-hmm.
Is there anything else on the horizon to continue achieving these goals?
Well, as I said, one of the biggest pieces, we can only control what we can as a local city. And so a situation table and city circle are municipally led. There are additional pieces we will need to continue to use, have the state address. As I mentioned, unfortunately, the Community Accountability Court is now closed. That is per the decision of the governor and the state. We need ongoing resources for our court system, to be very clear. We also need to make sure that the state actually ultimately solves one of our biggest crises, which is the high number of folks who are unhoused in our community. We continue session after session with the legislature and year after year with the governor to not have tangible new solutions coming forward to address this unprecedented number of people living outside. And as the largest city, we hold a disproportionate number of hundreds of people living outside in the winter. And we see the impacts on a lot of our institutions, the emergency department, for example, at UVM Medical Center. There is nowhere for folks to go, and that is not an issue that a city alone can solve, let alone resource and build sheltering. So we really need stronger collaboration and action by the state. I'm ever hopeful that the legislature will address this year, take another round at it. There is a bill moving through the House currently, but we need to make sure the municipalities are resourced and the state actually holds the resourcing ultimately for safe staffing, for actual alternatives that are sustainable, and not spending money on expensive pop-up shelters that are limited in scope and time, and I think expend money in ineffective and not cost-effective ways.
A question about the full circle program. When somebody is admitted into that, what are some of the exercises or things that they do while admitted into that program to get their sentence?
It's a great question for Becky, and it's City Circle, just so you know.
Thank you.
So we would get the ticket and hope they would show up at City Circle. That's happened. And we have someone waiting to do sort of a mini intake with them where we just learn a little bit about them. We orient them to the program and we decide if they can proceed to the circle process that day or if they're going to need a little bit of time to get used to the idea and also take responsibility. Some folks arrive for any restorative process ready to take responsibility with ideas and goals, and other people say, I'm not ready, I didn't do it, I feel harmed myself. So we figure out how much time they need. Once they get to City Circle, there's a team of 3 volunteers and a facilitator there. And after sort of settling in, they'll ask the person what happened, who was impacted and how, and what do you think you need to do to make amends? There could be a victim of that incident or crime, and so they may or may not be present. If they're not present, we would be working at that moment, if it was the same day, to reach out to them or to go find them. And we want to get their input. We want to understand what they need to feel as healed as they can in this process. So we'll have that conversation with the person responsible, potentially with the victim, and maybe in that day, but if not, the next week, develop a restorative agreement that really attends to the list of folks that that person impacted. So when we harm someone, there's a little bit of a ripple effect, maybe a great ripple effect, depending on how serious the crime was. And so the person makes a list and the volunteers help round out that list. And then we go back to the list. And if you were on that list, we would say, what do you think you need to do to make amends for this person? And there would be an idea there. There also might have been something that was already done, so we would give credit for that. But we also want to know what the cause of this is. Like, are you struggling with your mental health? Has something terrible happened to you recently? Do you have a substance use problem? You know, what's happening here that caused this moment for you? And it may be something big. It may be just a really bad day. We attend to those things. So they might get a referral for a substance use assessment at the Howard Center. If they haven't seen their doctor and it seems like that's the right path, we ask them to make an appointment with their doctor. So it's you know, those are the pieces for them, and those are the pieces that, you know, create a safer community for all of us if we're attending to those needs. So those things go on the agreement, and then the tangible things like I just need to say I'm sorry to so-and-so, that goes on the agreement. They'll come back a time or two to check in with that volunteer team about their progress. And they also we're open at the Burlington Community Justice Center for them to pop in and work with their coordinator as well. Once they finish that agreement, we let the city attorney's office know and the issuing law enforcement officer, and the ticket's voided. If they don't finish with us, we give the ticket to the city attorney's office and they decide if it will be prosecuted or if it will be dismissed.
Very thorough.
Thank you so much.
Yeah.
So this didn't come up directly in this presentation, but I think tangentially it's pretty related, and it's the Overdose Prevention Center. And I'm curious if we can get an update on that, and specifically I'm wondering how you're doing about securing a location, whether you've determined that you actually are going to be able to rent a place, or you're looking to buy a building. Can you get any update on that?
Mm-hmm. So we, the last summer, selected as the service provider, because the city is actually the holder of the resources. So we're the granting entity per state law for this pilot for the state. And our service provider is VCJR, Vermonters for Criminal Justice Reform. They are the folks taking the lead of looking for a location and doing the legwork needed to figure out what would be feasible for this kind of space. There'll be co-located services within it. It's not just safe consumption. So there's many components they're looking for, as well as within both the enabling legislation, but also our expectations is that we want to make sure the site is aligning and aligns up with and is informed by data. So it would make no sense at all for us to place an OPC on the far edges of town off of a public transportation system network, far away from other co-located services like other health services, et cetera. And so we want to be really mindful about that. So VCJR has been taking a lead on that and looked at various properties, but nothing has tangibly come together yet that is a serious, viable location. But we are working in close partnership. That's the expectation of the city, because the other piece of this that we committed City Council and Mayor to is a robust community engagement process around any site location, so that neighbors and abutting other entities have a way to engage, ask questions, we can hear concerns, we can do all of that work ahead of time. That is a deep piece of learning we had from Providence, Rhode Island, which is operating currently an overdose prevention center, and went through many different sites until they finally found the first one. So we're going to take our time to make sure this is right. But we are also on track with the rest of the OPC development process. As folks might recall, we had a community survey that went out. We have an assessment as well with folks who do use drugs in order to get further feedback on what are the components needed for this to be a highly utilized space. We do not want to create something that would not be used. We don't want to create something that is not evidence-based based on other OPCs that have long operated in other parts of the world. And so this is the period of time in phase one that we're putting all those pieces together. We are required to give updates to the legislature and to the state, and so we've been doing so, and we're in compliance with that. The grant from the state did not actually get released until this fall, so a lot of the staffing up that's required by VCJR has just begun because we waited for a period of time for the Department of Health to release the funds.
Has it been considered that you actually might need to buy a building? Are you finding that someone might be reluctant to?
As you might imagine, this is a very unique project, and so leasing is a very difficult combination. They have not been successful in finding that kind of scenario where something could be leased. So a building of some sort in a different scenario will likely be the outcome, but that's the work that's underway right now, is finding what partners exist out there and what are the options.
And then just the other question, if you do have to buy a place, it seems like logistically aligning the transparency piece of that and getting a lot of the community feedback, but also buying the place. I mean, how does that, it seems like a really difficult thing to do.
Not difficult, but not impossible. I mean, what ultimately I want to remind folks is that this is going to be a life-saving tool as part of our community safety response. We have been, much like we are struggling with a homelessness crisis, a mental health crisis, we are struggling for a long time with an opioid crisis, and making sure folks have a safe, effective place to land. That's a different tool within our toolkit, and our response is critically important. So doing deep engagement is important, so folks have facts versus, I think, some old, outdated ideas. Perhaps I'm a kid from the DARE program, for example. There's a lot of misinformation about drug use and issues of addiction and what substance use is. So there's a lot of education that I know Burlington has been on this journey of better understanding what we're grappling with. But that's the deeper work within the community we need to do around a site location. Also, safe consumption won't necessarily be happening day one. There's other co-located services that will also be established. That's very purposeful to make sure that we're building out a center that we can stand up and that we can make sure we have the adequate staffing for. As I mentioned before, we need to make sure we have all those components in place to be in compliance with what state law is expecting.
Yeah, I'm sorry. I think I was a little unclear there. What I was trying to get at is that we were here a year ago and we were talking about what this process would look like, and the hope that by the end of the year we would have some proposed sites that people could give feedback on. If a building needs to be purchased, I think there is a concern that a building is going to be bought here. This is the place we're doing it. The community feedback aspect of that is a bit limited when you have a building in place already that you've purchased. But I imagine it is difficult to get feedback on a building before you purchase it. So
Right.
I'm just like, how do you?
I'm not a real estate developer or attorney, though I sometimes play one on TV, apparently. That's a joke for Sarah George. But I hope I did her proud today. But the piece around real estate, especially commercial real estate, is that there is a long runway for under purchase and sales agreements, et cetera. So it is not like a purchase is going to happen in one day. It allows time for proper engagement, as well as outs, if you will, within that purchase and sale agreement, if for some reason it doesn't turn out to be the right space. So we're being very methodical about this, making sure that we're not bringing to the community something that's not a viable location. That takes a lot of heavy work. There's phases of work of securing a right location. And certainly no formal purchase will happen in an accelerated way that would shortchange the community engagement process. Okay.
What's the timeline then look like on opening up the OPC?
So we are still on time in terms of phase 1 of what we prepared for the state in terms of the community surveying work, the staffing up, the grants, the grant, securing the grant and the funds flowing to this, the city to then go out to VCJR. In terms of a site location, that we're on track, believe it or not. I mean, March would have been the earliest of a site location. And again, all the earlier things I said before, not purchase of, but siting and location. So we're vetting lots of locations over the last several months. I want to say again, the Department of Health grant not coming until late. They were late in releasing those funds has sort of slow down VCJR's ability to staff up to do this kind of work and have the resources to locate a building. But we are still staying on track despite that and trying to move forward. I don't have a crystal ball. We have a lot of sites in Burlington, but we have to also find the right partners who are willing to engage with VCJR for this kind of purpose, as well as what I said before about the location, co-location pieces that we need to make sure it's near where people, the data shows us where overdoses have been happening. It needs to be in other places where people can get to it, et cetera.
When you say other partners, you mean like the people that would be renting you this? Like, what are the other partners in VCGR?
That's sure. That's a key part. Like, who owns the property now? Or will it be a sale? Will it be a lease? What are what's the shape of the building, for example? Is it something that could be upfitted quickly? These are all kind of questions and requires many different kinds of partners at the table. And the city is a partner with VCJR, of course, but VCJR, this is their piece of taking the lead on.
Do you anticipate releasing some potential site locations in the next month, 2 months? Just what is that specific?
Right. I don't know how that information at this point. VCJR is again vetting many different pieces of property, and nothing has come together quite yet to be a tangible location.
The last piece on that, I mean, obviously you're facing a budget hole right now as well. And is that going to complicate efforts to purchase a building? I imagine the grant funding that you're receiving will cover that, or would it?
So these are separate funds. So my other problem is the general fund, which is raised by our local property taxes, our grand lists, among other fees. This is a completely separated piece of money that comes from the opioid settlement funds from the state, and that comes through directly from the state, which we pass through to VCJR. So that they're not the same.
Use that money, the grant money, to purchase a building.
That is part of the enabling intent of of state law, is that money from the opioid settlement can be used for the location. Great, good, because I'm done talking about OPCs.
Chief, you were kind of mentioning how gun violence has gone down, especially in the downtown area last year. I know you elaborated a little bit on the reason for that was the foot patrols, but can you just kind of tell me a little bit more about why you think this downtown is becoming much safer for people?
Yeah, I think there's been a lot of different influences on how people actually perceive safety. And during the earlier question, I was thinking about, like, we had a great October, late September in the downtown. The weather was perfect, and it was because people came downtown to enjoy Church Street. And Saturdays and Sundays, the streets were full. And we know that anytime that a space is vibrant, that there's not going to be bad actors out there intentionally committing crimes, especially, when you think about our drug dealing, our gun violence trends. Typically they involve people involved in the drug dealing trade, and they're party to a dispute, and they happen upon one another, and that's when the violence breaks out. So anytime that we have excellent programming in the downtown area, that aberrant behavior is displaced. A big part of getting people willing to return downtown to enjoy what we have here is having uniformed public safety professionals out and about. Anytime that you can put a uniform in a space, there is an ambient feel of safety. And of course, it also allows us a couple of unique opportunities. One is to establish and maintain meaningful relationships. That's foundational for folks having trust in the police department. And the other is early intervention. Anytime that we can get folks separated that are starting to escalate with one another in terms of like a verbal altercation before that goes to an assault or greater, that's meaningful work. And it also kind of leans into what I was referring to earlier and what an effective deterrence model is. If a person knows it's likely they're going to be caught for their behavior and there's going to be some type of swift penalty or consequence for their behavior, that's the most effective deterrence model.
How do you determine how many officers you put downtown at night or during the day?
So it comes down to availability. So, and we've done that for years. I mean, even when I was here in the late 90s, you kind of know how the city behaves. So when you think about the vibrant nightlife that we afford down here on Church Street, we would bring in all the officers from around the city. You know, back in early days, that could be a number between 15 and 18 officers to come down and be on foot and available here in the bar district, if you will. And then during other times of the day, we would strategically use, just like we do today, what we have in terms of available uniform officers as the data instructs. And we know that downtown was our challenge in 2025, and we adjusted accordingly. And we're preparing a patrol plan to do something very similar in 2026.
I've seen some troopers down here as well. Where did they go into play? Do you guys work together and them coming down here, or how does that work?
Yeah, certainly. So that was part of the plan that the mayor and the governor came together in terms of an immediate action plan for the downtown. And we were afforded the luxury of having Vermont State Police join us in a very strategic way and being present throughout the holiday shopping season. That wrapped up on New Year's Eve. And, we're very thankful for that opportunity. And I do continue to talk with our partners with the state police about what this may need to look like in the spring, because we know that a lot of the challenges that kind of went away in November were directly related to early onset of a cold, snowy winter.
So regarding the data that you presented, there's like 3,000 foot patrols. Your officers are out on foot patrols and they see something and they break up a fight. Does that get then cataloged again? Do you have could a foot patrol lead to 4 different incidents?
Yes. Yeah. So anytime that an officer is going to have an intervention with a member of the public, whether that's an ordinance violation or intercede in a fight, that would be a separate incident.
You also mentioned, I think, something about dispatches into mental health incidents, sending out the CAIP team or others without officers. I mean, I know that there's always been sometimes the embedded social workers want to go out with an officer. Are you sending social workers out now on their own to respond to calls? I'm just wondering if it sounded like that was maybe a newer development.
That is a new evolution, something that we brought online in September. So we talked with the professionals doing the work, and so not only our community support liaisons in-house, but our partners with Street Outreach to get a barometer on what they would feel comfortable in responding to by themselves, absent danger acuity. So anytime that there is potential for violence or danger, we do rely on a co-response, an officer and either a CSL, as we call our community support liaisons, or Street Outreach professional. But anytime that we can use that resource by itself, especially with the clients that they serve on a regular basis, that frees up our limited sworn staff to be available for other calls for service. Again, we still face upwards of 20,000 incidents that we need to contend with, or just simple calls for service from the public. When you think about our overarching number, the big number, 35,000, it's very interesting to dive down and to see how many times the public calls and expects and deserves a police response.
Question for Chief Curtin, if that's all right? Sure. In the data, the red line for 2025, it was a lot higher than originally than the years before.
Yep.
Why do you think that trend is increasing in terms of responses?
I think, one, the city just growing to a degree, and also people are getting older, right? So you're experiencing more medical incidents and things of that nature. So that's the theory anyway.
And then, I guess I was going to ask why you thought there were so many EMS responses, and is that number on par with previous years, or was that a jump or lower than?
No, it sort of stays consistent with 70% of our call volume is EMS. You've seen that if that was back up. And I broke those out, you could see that it's pretty much a steady climb throughout the years.
All right, so I think that's time. Thank you for being here. And again, just a reminder, you can come see Jen if there's any additional topics that are not related to what we covered. And we'll send out the slides afterward when we're done. Thank you very much. Appreciate it.